Hello and welcome. Our first question is for Ms. Champagne. Why are you advocating for mental health?
I have a son with a serious and persistent mental illness. He was actually born with that mental illness, and for the last 25 years, he's almost 25, I have had to advocate for him because unfortunately the system in New Hampshire, I hate to use the word, but it's broken. There are a lot of gaps in the system for children. So as a parent, you love your child so much, you have to get your child the services that he or she needs. So that's what I did. I rolled up my sleeves and I fought and created and didn't say no and pushed to get services for my son. Some that just needed a little boost, but I've been so vocal about it because he's one of many. We know the statistic 1 in 5 have a mental illness, so we need to serve those children in this state and do a much better job than we're doing.
Have you had a lot of pushback on trying to get more support for mental health?
Yes, it's a costly expenditure, and a lot of people don't actually see it as the crisis that it is. Sometimes with an invisible illness like mental illness, people think, well, if you just toughen up, then you can get over it. But a serious and persistent mental illness needs medical treatment, as does a broken arm. So I want people to get to the point where we can see a mental illness on par with a physical illness.
So, Ms. Champagne, in a nutshell, what is Senate Bill 14?
Senate Bill 14 is probably the answer to my prayers. As a parent, when my child was in crisis, I had two options. I could see him hauled away in the back of a police car, usually in handcuffs, and brought to a hospital, or I could take him there myself and sit in the emergency department and wait for hours, days, or weeks for a mental health bed to open up. Sometimes he didn't need that. Sometimes he didn't need that level of care. Sometimes he just needed someone to de-escalate him in his school or in his home. And a lot of what Senate Bill 14 does is support something called mobile crisis. The lengthier term is mobile crisis response and stabilization services, where a trained team of experts come to the child in the home or the school, and give that child the services that he or she needs to de-escalate, and then they can go back about their business. When you bring a child to the hospital and they wait in an emergency room, that only exacerbates their symptoms. Or if they get taken in a cruiser in handcuffs, that only makes the system worse. Having someone come into the home and de-escalate, that would have changed the course of our lives, in such a positive way. It would have such a positive impact on our youth. So that's my favorite thing about the bill. There are so many other great things about the bill, but if I could really educate people about Senate Bill 14, it would be about the need to transform the system, but specifically bring in mobile crisis to our state.
And do you think it's going to be enough?
I feel like the momentum is really strong. I sat in the first vote at the Senate, and it passed unanimously, 24-0. My colleague and I, we were dancing in the halls. We were like, they finally get it. These intelligent people, we're finally getting to them. They're understanding, they're getting the message that this is important. So we feel like the right people are in the legislature right now, and we feel like the momentum is strong. There's been 4 votes on it in different committees, and they've all passed unanimously.
What can parents and teachers do to help the youth who are struggling with mental health?
There's a lot of things out there, but we're not great at getting the message out. We operate in silos very well in this state. We don't talk to each other, but we do have some great programs out there, and I think Dennis will talk about some, and I know you'll have Sean Perry on, he'll talk about some. We do have great programs. Unfortunately, We are good at having things done in pockets throughout the state. We don't have a unified system of care where these great programs are happening everywhere. So part of the work that Becky and I do is to bring that awareness to folks that we need to spread these programs throughout the entire state. But we do have programs out there.
So the bill obviously talks about providing services for children who are struggling with mental health. But let's say you have a friend who's struggling. What steps can you take to help them?
Well, honestly, my first step is always mobile crisis. We currently have 3 mobile crisis systems in New Hampshire: Concord, Nashua, and Manchester. I have their number right in my phone. Whenever someone calls me and says so-and-so is in crisis, I forward them the mobile crisis numbers. That is the best place to start. So we need to strengthen that system. That we only have 3 and they're in the southern part of the state is not okay. A lot of people in the North Country have mental health issues. So we're doing a disservice to the residents of New Hampshire by not offering this valuable resource throughout the state.
And moving on to Mr. Calcutt, why are mental health services so important?
I think they're important in several different factors, but most importantly, we need to bring these issues out front and into the open. These are issues that have been pushed away and stigmatized to the nth degree everywhere. You know, as Dellie said, it's 1 in 5, and it's debatable that it's 1 in 4, or it's 1 in 5 children, 1 in 4 adults. So the number of individuals who are impacted by mental health issues in our country is significant, and those are diagnosed individuals. There's lots of people who aren't diagnosed. There's lots of people who hide their diagnosis because our society is still not open to allowing someone with a mental health issue to be open about that. I have to, you know, if I'm having this conversation with all of us here, I have to feel comfortable and trust that I can share my issues with you, and you're going to handle them appropriately. And it's much like, you know, you pick any issue that has moved forward in the social realm in our country, you know, that's what we need to do for mental health. So a person with diabetes, a person with cancer, you know, if someone is confronting those issues in their home, their community will support them. They would have, you know, if my child had cancer, I would have a cooler at my door, and I could have a meal at my, you know, for myself and my family every night of the week until I told them to stop. But if it was a mental health issue, would I even be able to share with them that it's okay that I can tell people that my child has a mental health issue without being stigmatized, without people placing judgment on me and my family? And I'm sure that's happened to Dellie in her life. And the problem with it, and you mentioned, you know, is it enough? It's not enough. We don't have enough right now. We don't have enough for these issues. These issues are too great for our community and our society.
Obviously you work with the Monadnock Region System of Care. How does that help or assist with the issue of mental health with the youth?
Well, the Monadnock Region System of Care, you know, sitting in the Monadnock region right here with this is wonderful that you've invited me to it. But it is a regional effort, and we were fortunate in the region to receive this grant through the Substance Abuse and Mental Health Services Administration, SAMHSA, at the federal level. The state received a grant prior to us, and we are highly aligned with what the state's efforts are. But the focus is a system of care. And what is a system of care? And I sort of use my hands to say it's a network, and it's a framework for us to be thinking about how we're going to care for children and youth within our communities. And it started at the federal level, and it's been around for over 20 years. And it's coming to New Hampshire later, but I would say that the work that's being done in New Hampshire has been done really at a very nice way, at a really well done level. And we're really building, and I would say we're still in the infancy stages of it, but we're really building the pieces to get it started. And so when you talk about services specifically for youth in the Monadnock region, we're working with kids and can work with kids anywhere from 0 up to 22 and beyond. It's kids and youth, but it really is helping people understand what potentially is out there. And we've started to put certain pieces in place. The biggest piece is wraparound care, and that's an intensive wraparound care coordination effort to help the highest need kids. So if you look at a triangle, the tip of that triangle are the kids who need the greatest amount of support. And so we want to support those kids with this care coordination effort. We're evaluated on our work. We are constantly looking to see where it's going to take us and how it can be improved. But what we have seen early on and what we've seen in correlation with another system of care grant that's happening through the Department of Education and the work that already happened at the state level is the outcomes are better and the costs go down. So that's very promising, but that's the wraparound piece is one component of it. Dellie talks about another component of it is this mobile crisis. Other components will be helping kids that aren't at that highest need, because there's plenty of people who have mental health issues that are managing within our communities, but we need to be able to support them. You know, take the students on this campus. You know, you're in that transition age, you know, transitioning from a youth environment to an adult environment. And that can be very challenging, especially around mental health issues. And can we support those students in the same ways? So you're looking to build that, and that's the real framework of do we set up a system that will really support children, youth, and families so that they can manage what's going on within their own worlds and within our society to be able to support them appropriately.
So how do you think we can encourage people to have that conversation about mental health? And like you talked about, the stigmas against it, because I know a lot of college students here have mental health issues. So what advice do you have for them?
Keep speaking about it. I would say the first thing is, and I would say the students on this campus are in a far better place than I was when I was on my campus, because students are talking about it more. It's more out in the open. There is far more services on campuses, you know, where there is a counseling department probably on this campus. But most importantly, it's having the conversation, it's normalizing the conversation, it's allowing for and providing for people to do that in a safe way. So if I was going to share with you what the history within my family is, or what the history in your family is, that I'm doing that in a way that's supportive of you and protective of you as well, because you may not know me, and you feel it's safe if you had a mental health issue to share that with me. And if you're going to do that, then I'm going to do that in a way that's really protective of that process. But most importantly, I think it really is doing exactly what you're doing right now. You've brought this to the stage. You're asking for it. You're asking people to come and talk about it, and we need to continue to have that conversation. Mm-hmm. So I really appreciate it.
Kudos. Yeah.
Okay. Miss Whitley, can you describe to the audience a little bit about the Children's Behavioral Health Collaborative?
Yes, absolutely. So about 10 or 11 years ago, the state actually got together to develop the first 10-year mental health plan. We are now actually in the process of implementing a new 10-year mental health plan. But the old 10-year mental health plan actually didn't include children. They weren't mentioned at all. So that's a problem, right? Because children, as we know, as we just talked about, they struggle with mental illness, and we need to be able to support them and support them early on. So people around the state got together and said, we want to address this issue. We want to make sure that children do not fall through the cracks, and we want to do it in a coordinated way. And so people got together, supported by the various funders in the state, and had a series of listening sessions, learning sessions, all with the goal of coming together to develop a sort of framework to move the system and all work in the same direction. So the collaborative really firmed up in several years later when the group issued a strategic plan. And so that was the roadmap about how are we going to transform the system to support kids with behavioral health needs. And so when we say behavioral health needs, we're looking at both the system that serves children with substance use disorders and the system that serves children with mental illness. So once that strategic plan was there, we were off and running. We had a roadmap. What are our next steps? So the collaborative actually is really not its own nonprofit. We are a loose membership organization, 70 plus groups coming together under these guiding principles. So as Dennis mentioned, the framework that all the collaborative members chose to move forward with is called the system of care. So the system of care is basically a framework for system transformation. And what's really important about the system is that it's value-based. The values are very important to our work. One of the important values is that the system is community-based, meaning that we are doing our best to make sure children are getting services in their homes, in the community, so we're keeping them in school, we're keeping them connected with their families. It's a very important value. The other value is that the system, both building in the system and both how we deliver services, are family and youth driven. So meaning we're not going to build a system without input from the people who it's going to serve. And not only building the system, but when we're offering services, providing services, that value is infused at every level. And then the third value is that the system is culturally and linguistically competent, meaning we're meeting people where they are, that the services are sort of reflective of the people that are receiving them, and that they can access them in a way that's really meaningful for them. So here we are, 70 plus organizations, 10 years later, we're all moving in the same direction using this core values. So in about 2015, the system itself took a step forward when the New Hampshire legislature passed the system of care law. So now there is a state law, RSA 135F, that directs both the Department of Health and Human Services and the Department of Education, so the state, to use the system of care framework, use these values to transform the system, to work together to break down silos. And the whole idea with the system of care is that kids get the right service and at the right place, right? So we want to make sure that wherever they are, they're getting the right service at the right time. And so that's the whole idea with the system of care. So now that we have a system of care law, the system has been developing, right? It's not perfect. It takes a lot of work to do system transformation. It takes everyone at the table. It takes tough conversations. And what's exciting for us this year is now we have SB 14. So Senate Bill 14 is really the next phase of system transformation. So that's really exciting for us.
All right, thank you.